good morning, good afternoon, good evening, whatever time it is you are watching this. Welcome. So, let me get adjusted here. What did you do this week? I'll start backwards. So, this weekend we did the Tea Fest. So, was volunteer coordinator for that. So, we were there for that. So, that was really exciting. A lot of fun. The Tea Fest, trying different teas and everything. And then good news, Bentley is in remission for his kidney disease. So no more kidney disease. We got his creatinine down to 1.4. Normal was 1.5. The last one in February was 1.6. So, we just did that. So it's 1.4. So excited over that. So we did that with integrative medicine, integrative veterinary medicine, obviously. So medications and stuff for him, plus acupuncture, which turned into laser therapy, and then or laser acupuncture therapy is interesting. So they do the laser and it hits the same points with the acupuncture. And so we do that. And then, of course, we added in the sound frequency therapy and energy healing therapy with him as well. So, yes, so it does and can work. Again, everybody's different. Every animal is different in responding to things like that differently. So with him, he responded very well to it, and we're excited for that. So yes. Yes, that was like our news and fun stuff for the week. So anyways, yeah, definitely comment, like, what did you do? Anything fun, anything exciting, interesting, any questions, concerns, or anything? All right. So even if you put a congratulations to Bentley in there, that's okay too. I will take it. But all right. So we are going to talk about when is the time for you to have a second opinion or go get a second opinion. A lot of times people don't even think about this or even know they can do this. So sometimes we don't need a second opinion, and that's okay. But a lot of times we do. And how do we know when we do? Medical gaslighting isn't always obvious. I get it. You're diagnosed with cancer and your whole world turns upside down. The last thing you're thinking about is and if you need a second opinion. I remember my aunt when she was diagnosed with ovarian cancer, and where they lived was literally about an hour outside of Charlotte. And, my mom, walking miracle, went in remission and where she went. So, but when my aunt was diagnosed with it, they were so stunned, shocked, going through all those different emotions that her doctor recommended her to a gynecologist, oncologist 45 minutes away, like the other way, and not where my mom was. And so they went on to that, and and he was like, and even the doctor was like, oh, this is where my wife went and everything. And we don't think the doctor did a very good job, but she, at one point, she did get a second opinion with that. But my uncle told my mom, it was my mom's brother and then his wife, he told her, he said, I wish we had come to where you were. Like, but honestly, we didn't even think about it. Like, you're in such a shock stage. You just kind of shift and go where the doctors kind of shift you off to or push you off to. And that's understandable. So this is why we're talking about this today. But we were lucky, as my uncle on my dad's side of the family was a pediatrician. My dad's youngest brother was a pediatrician. And he was just as picky about doctors as we were, because my uncle was one of these people, he wanted to get to the root cause of things and and fix it versus just band-aiding the problem. He wanted to fix what was like the root of it, what was causing it, so you didn't have to deal with it anymore. So yes, we knew he was picky as we were. So he's one of the good ones, as we like to say, or as I like to say, he's one of the good ones. So we had all my mom's doctors reach out to him and talk to him first. We had to have his approval, as we were in uncharted territory. Her doctors actually impressed him, and with all due respect, like, they made my mom a walking miracle. So understandably, yes, I mean, it all makes sense at the end of the day, right? She wasn't a textbook case because she shouldn't have survived. Even my uncle thought that my mom was not going to go into remission the first go round, and he even said that, like, after the fact, not beforehand, but like after the fact. And so, to tell you how much these doctors really impressed my uncle, because they did something my uncle didn't even think was possible. Because again, like you said, what they had studied in medical school, like, it was, my mom shouldn't have survived, and she did. But my mom humbled a lot of doctors, and she stuck feathers in their hats. But they deserved every feather from my mom that they got. Like, yeah. But not everyone has this. We were even lucky with my mom's GP. Her GP, interesting enough, is actually also an internal medicine specialist, and her office was literally like right downstairs from where my mom worked. And so my mom went downstairs. My her GP was off that day, but she saw her partner. And so her partner, she didn't like what she saw, even though she thought it was the tumor. She took x-rays, and she thought it was a pneumothorax, but it was actually a tumor. And so she sent her on to the cardiologist, who was also a lung specialist. And he was like the top notch in the area at the time. And so, so much, like, he had done heart surgery on the owner of the NFL team, like, at the time, the owner at the time. So he was literally top notch in the area, and he didn't like what he saw. So he actually had my mother check into the emergency room, because he knew he could get those tests quicker than he would be if my mom had scheduled appointments. If he had my mom schedule appointments for the tests that he wanted to run, it would have taken months for her to get in there. Whereas then he was like, no, we're going to check you into the emergency room or into the hospital. And he's like, and they're going to fit you in for your test. And she had her test. I think she was in there for like a day or two, if that, and to get all the tests that he needed. And so again, not everyone is this lucky. When not everyone is this lucky. Like, I get it. But I'm telling you these things so you kind of know what top notch looks like, what it looks like when a doctor is fighting for you or doing thorough tests for their patients. So when to get a second opinion, right? When do you get a second opinion? Follow your gut instinct. First and foremost, if your gut instinct tells you, hey, you know what? I'm going to go here and talk to another doctor. Like, do it. Like, it's telling you that for a reason. So whether that reason is confirming that you need to stay with the original doctor, or whether that reason is like, no, the other doctor is going to tell you something different that's more accurate. Okay. So there could be two different reasons for that. Right. So, and keep in mind that sometimes good bedside manners doesn't necessarily make for a good medical doctor. I say that in a sense. All my mom's doctors did have good bedside manners, though there was one that was, his bed, I would say their bedside manners weren't as what the other ones were. So we ended up, but I mean, we stayed with him, and I mean, he was really good. He was really good. I mean, he was doing surgery on my mom and everything, and he was really good. I don't, so I don't fault him for having not so good bedside manners. But here's the thing: if you're a damn good doctor and you're gonna do what's best for me, my loved ones, or my fur babies or whatever, I don't care what kind of bedside manners you have. Because most importantly, how yes, I want to feel comfortable, but I feel comfortable with your knowledge, not with your bedside manner. Does that make sense? Like, it's how they say sometimes the most intelligent people aren't necessarily the best, like, or the most outgoing or the best person to be able to carry on a decent conversation with. And there's nothing wrong with that. In this case, you want that intelligence. You don't want the bedside manner, right? Because you want to do what's best for you and your loved one. So yes, just keep that in mind. Gut feeling and then bedside manners not always means medical. And if they don't have a good bedside manner, again, it doesn't mean that they're not bad, but it also, it doesn't mean that they're good either, but it could mean that they're bad. So either way, so just follow your gut instinct, okay? And don't get like smooth into the charming aspect of it either. If your symptoms are getting brushed off, so if you're telling, if you're telling them your symptoms and they're brushing them off, like that's not a good thing. My mom, her oncologist was amazing in the fact that I still remember after my mom had went into remission the first go round, I remember going in and she was telling her oncologist, hey, like, I get, she said something like, yeah, I get inner ear infections like I do head colds. The look on my mom's oncologist's face she was very concerned by this. And though my mom didn't see it, I saw it. And so because here's the thing, when you have lung cancer, it goes in remission. When it comes back, it's going to come back in one of two areas. It's either going to come back in your brain or come back in your bones. So my mom was in remission from stage 4 lung cancer. So my mom's oncologist was right on it. At that point, she said, you know what? She's like, let's get you an MRI just to be on the safe side. And guess what? The first one was clear. Her first MRI was clear. But after that, she added the MRIs into my mom's checkups. So when she was doing her rechecks for her scans, she added the MRIs in. The first one was clean. The second one was when they found the 2 tumors. So I think it was a 3-month time span. So from the time that like the one was clean to 3 months later, she had a tumor the size of a quarter in her frontal right lobe, and then a size of a dime right above her left ear. So just to tell you how quickly these things can come on. But because she was right on it, we caught it early. When you're hearing it's probably this, instead of getting answers, like a lot of times I will say, some doctors will say, okay, it's probably this, but less, when they finish that follow through with, but let's do this just in case to make sure. So I say that for a number of reasons. So my mom, even with my mom, she was having a lot of pain in her pelvis areas. She was having a hard time walking. Her GP, honestly, was amazing, but because she had went through the similar, her parents, I think her dad or something had gotten cancer and she was taking care of them, but she was also the one that recommended my mom to the oncologist that she had because she was good friends with that oncologist. She told my mom, she was like, she had my mom set up with like three of the things. She had my mom set up with like an orthopedic doctor, x-ray, and then bone scan. Because again, like I said, even though my mom was in remission, lung cancer, when it comes back to your brain or comes back in your bones. So boom, she had her set up with three different things. Like, here, let's do this, 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 and this, and make sure, let's, even if it was just, ruling things out. And so, and of course, when she did the bone scan, that's when we found the tumor on her pelvis. So and then of course that led to others, led to her pet scan and stuff. So, and catching it, the third time. So, yes. So, doctors will say it's probably this, but when that's also them brushing it off or brushing off the symptom. But also too, if they say, hey, it's probably this, but let's check this out just in case, that's a good thing. But when they don't say, but let's do this just to make sure, like, no. Even with me, my doctor, she was like, hey, it's probably she's, when she felt like my ovary was enlarged, she's like, it could be you ovulating, but I want to make sure it's just that. So let me see you back in 6 weeks. And so when I came back in 6 weeks, like, sure enough, it had gotten a little bit bigger. And she's like, no, it's not you ovulating, like just ovulating in that ovary. It's you, it's a possible teratoma. It's something. So she went forward, and she was like the only doctor who never really brushed it off, because all the other doctors brushed it off. So I brushed it off for years. So yes, don't let them do that. Also, when you're being interrupted mid-explanation, like if you're explaining something and they interrupt you, like, that's not a good thing. Unless they're asking you for more details on something. Because some doctors will, like, when you're telling them something in the middle, they'll ask you to elaborate more, or what type of pain, or what, for more details. That's fine. Because, sometimes some people, they do better, like, in the moment, so they don't forget what to ask you or forget about it. And that's okay. Like, if they're interrupting you to ask you more questions to elaborate on it, to get more details, like, that's fine. But if they're interrupting you and kind of, like, again, brushing you off or whatever, no. Like, go get a second opinion. All right. Appointments feeling rusted. So if you're not feeling you're getting what you're getting out of the appointments, side effects getting minimized. So again, same things, very similar, kind of brushing things off. Or if you're having side effects and you're like, oh no, that's perfectly fine, that's kind of what goes on. So, and sometimes it is. But again, if they do the follow through of like, okay, it could be this, but if it continues, call me back and let me know, and we'll do this. Okay. So like, sometimes, again, listen to what they say, because sometimes it may seem like they're minimizing it, but they're not. They're just making sure, because when you don't want to go through unnecessary tests that you don't have to go through, it puts a lot on your body and on your system. And especially if you do have cancer, so you want to try to preserve as much energy as you can and health with other parts of your bodies and cells as you can. So some of it could be they're trying to not put as much strain on your body. So again, listen to what they're saying. So if they're saying, hey, it might be this, but if it continues, give me a call back and we'll do XYZ. So again, do that. If you call back and they still put you off and don't do that, then yeah, go get a second opinion. But if they respond to when you call back, if you continue to have that and they respond and respond to that and do what's necessary, then keep going. Yes, that's a good thing. And so, when they say, like, that's uncommon when many patients describe the same issues, leaving with more questions than answers. Let me tell you, when we would go see my mom's doctors, we were in there for at least an hour, if not an hour and a half, for every session, just about, when she was going through this, because they wanted to make sure my mother was comfortable, I was comfortable, had no questions, we understood, like, I should say as comfortable as we could be, but definitely comfortable with them, because their goal was to get my mom disease free. And they answered every question we had. They sat in there always. If we had a question, we could call them, email them, and they were on top of it. They responded every question they had, or we had. Like, they were awesome. Make sure your doctor answers any questions and does not, and they never made us feel rushed at all. Like, it was never oh, I got to go because I have another patient waiting. No. It was never any of that. It was always, do you have any more questions? Realizing your symptoms were serious much earlier than anyone acknowledged. So if you're realizing you have serious symptoms and they're not acknowledging that, find another doctor. Okay, go get a second opinion. Also, too, is someone, if you're talking to someone and you tell them, and you're talking to someone and someone says, hey, like, have you gotten a second opinion? Ask them, why did you ask me that? Just out of curiosity, just ask and hear what they have to say. And with whatever their response is, sit with it for a while, sit with their response, and then, ask yourself, like, why do you feel the way you feel with what they're saying? I say this as I had a friend of mine talking about surgery they were going to have, and something just told me, I don't know why, but something just told me, hey, did you get a second opinion with that? Because she was kind of young to have a hip surgery, and it wasn't like, or have this type of surgery, hip surgery. It was hip surgery. And like, it wasn't like she got in a car accident or anything. Like, she, it was just one of those, just kind of like through age. And I was like, no, to me, like, the age she was very young for someone to have like hip surgery or hip replacement surgery. It was crazy. And so I was like, did you get a second opinion? And like, she's going to get a second opinion because of it. And she's like, thank you. I've never thought of that, because she talked to one of her other friends that is and does something else in the medical field, and they said the similar thing to her. And so when somebody tells you that, like, pause for a moment, ask them, why did they tell you, why do they feel they need to tell you that? And they could be like, I don't know, I just said that, or whatever, there could be different reasons, but listen to them and then sit with it and figure and decide, like, how do you feel about what they just said? And then, then decide what you want to do. Okay. So I say, if any of these or all of these are going on to get a second opinion, see how that works out. And if it's any different, you may get the same thing with the second opinion. And sometimes you may have to do a third. It's all follow your gut. Like, see how it works, see how it's worked out. There's nothing wrong with this. Keep in mind, there's nothing wrong getting a second opinion. You need to feel that your doctor is fighting for you and with you. My mom always said she was the quarterback. My dad and I were her defensive line, and her doctors were her coaches. And we were all her fans, supporting her and cheering her on. So you need to feel as if your doctors are a part of your support system. Don't be afraid to advocate for yourself. And it's also not a bad idea to have someone with medical knowledge to talk through some of this with you. Not AI. Do not use AI to do this. You can look things up and see what AI says, but don't take recommendations off of AI. And I say this because here's the thing. AI is not a replacement tool. It is an assistant. So, and when I say that, it would be like as if I had an assistant right here and I'm telling them, hey, I need you to do this, 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 and this. Hey, what are your thoughts about this, this, and this? And I'm paying them. Well, their job is to tell me what I want to hear. And AI does the same thing. AI learns you, and AI is going to tell you what it thinks you want to hear and not what's actually correct. So that's why I said don't, again, you can utilize AI for some information, but don't utilize it to recommend if you need a second opinion or what to do medically. Okay. And remember, you're paying them, the doctors, you hired them, the doctors. So make sure they're doing the job you want them to do. Okay. And with that, don't be afraid to ask for what you need. All right. So keep that in mind. And know we here at Willow Haven, we're always a part of your support system. All right. So sorry I didn't mean to go so long today, but thank you for watching. And again, if you have any questions, concerns, anything, throw it in the chat. Email me. It's okay. Like, we're here. All right. So until next week. Oh, I've got to ask you what you were drinking. Yes, I am drinking Portland breakfast from Stephen Smith. My steamed milk, organic stevia, and organic vanilla. So my version of a London fog. So yes. Anyways, all right. Until then, we'll see you next week under the willow tree. Go do something fine.